Daunting. I'm very much in my comfort zone. I love public speaking. Right. Just over 5 years ago, in May 2011, aged 34, I was diagnosed with melanoma. Despite attempts to be cautious in the sun as a child, I had, on a number of occasions, been sunburnt. Sunscreen simply wasn't as effective when I was growing up. It was low factors and not waterproof, and I tended to spend most of my summer holidays in the sea. My original melanoma was just below my right shoulder blade, so it seems fairly clear that sun damage was probably responsible. The next few months after diagnosis were horrid. Lots of hospital appointments, tests, scans, wider local excision and sentinel lymph node surgeries, and by September 2011 the official diagnosis was stage 3 malignant melanoma, with a scar on my back and one in my armpit to show for it. At this stage I was told that the lymph nodes removed were all free of cancer, and my doctor attempted to send me on my way. Having done a lot of research over the summer and discovering that traditional chemo and radiotherapy were not useful in melanoma, I asked about drug trials. When pushed, he pointed me towards another doctor who was running the Avastin trial, and I was duly signed up for that. The trial was a year long, and if you got the treatment rather than the observation arm, as I did, you attended the hospital for 3 weekly infusions of Avastin. I was keen to do a trial, as I'd hoped that by staying very much in the system, I would be seen more regularly and any problems would be more quickly dealt with. The trial itself was fine. There were side effects, but they were minimal. And in September 2012, I had finished a trial and attempted to give myself a break from melanoma. I relaunched my baking business and worked very, very hard. From June through to September 2013, I began to exhibit what eventually proved to be symptoms that the melanoma had metastasised. I so desperately didn't want this to be the case, and so didn't push for a scan, and for some reason my oncologist didn't take note that raised LDH, loss of appetite, weight loss and back pain might mean something, and so suddenly 3 months had passed. On September the 24th, 2013, I was told that a CT scan showed I had multiple tumours on my liver and in the lymph nodes around it. I asked about potential treatments. I asked whether I ought to talk to other oncologists in hospitals. I asked about my prognosis. The options were limited. I was pointed towards a trial of emurafenib with the potential to also receive a MEK inhibitor. I was discouraged from pursuing other hospitals, and the prognosis was very, very bleak. However, due to contact with other patients, due to melanoma mates and carers, I was aware that there were other routes to take, and so, armed with this, I went elsewhere and changed hospital. I was signed up to the blinded ipi-nivolumab phase 3 checkmate trial and started treatment in late October 2013. For nearly 17 months, I had regular infusions. My tumours shrank considerably, and I sailed through treatment and relished the new lease of life I had been given. To my surprise, in February last year, I began to exhibit side effects: fatigue, loss of appetite, some nausea, and colitis-type symptoms. The symptoms were well controlled by steroids, but because of the trial protocols, I had to stop treatment. However, as my disease hadn't progressed, I wasn't unblinded. I didn't know what treatment I was on. I could guess, the doctors and nurses could guess, but no one could know for certain. This was a frustrating situation, but as I felt quite well, I was able to put it to one side, and for 10 months I ticked along quite happily. My scans remained stable, I had very few hospital appointments, and I had the time and energy to really enjoy my life. Sadly, this hospital-free period ended this January, when a routine scan showed that one of the tumours in my lymph nodes by my liver had begun to grow. At long last, I was unblinded, and to my team's surprise, I was told that I had had ipi and nivolumab. As much as I love and trust my hospital, I have, during the last 5 years, learned that you can't be complacent. All doctors and hospitals have limitations, and when it's your life at stake, you have to be brave and look beyond the familiar. Thankfully, because of Facebook Melanoma's site, because of my involvement with the Melanoma Patients Network Europe, I am very well connected with people who really understand what's out there. I was able to tap into that resource, and eventually, with that help and support, was able to make the decision to attempt a re-challenge, the ipi-nivolumab combination. I was aware that my choice of treatment came with risks, but I've learned that us patients are far from risk-averse. There's a lot we're willing to do to be around as long as possible. I have 2 young boys who are 8 and 10, and for them I will continue to take risks. Again, I was extremely lucky and sailed through my first 4 ipi-nivo doses without any serious side effects, and joyfully my first scan showed that the tumours were shrinking and I was able to breathe a sigh of relief that I'd taken the right treatment option. Unfortunately, the subsequent scan appears to be showing some progression. There's a possibility it's tumour flare rather than more sinister growth, and I'm due to have another scan in a couple of weeks' time, and I'll have a better sense of the situation then. It seems likely that I'll be moved on to the second phase of treatment, and I will start the maintenance dose of nivolumab. So, what have I learnt over the last 5 years? I've learnt to be a proactive patient, to do my own research, to ask questions, to seek advice beyond that given to me by my own hospital. I have learnt that whilst clinical trials are essential, and the one I took part in is the reason I'm still alive, they are not patient-friendly. The life of the patient is not their number one focus, and because of that, far too melanoma patients are still not able to receive the drugs that are proven to be successful. I've learnt that patients are willing to take far greater risks than carers and clinicians, and I have learnt that you can adapt and cope with the most extraordinary situation. A stage 4 diagnosis was the thing that frightened me most when I was first diagnosed with melanoma, and yet I'm still here. I'm still me, and in fact, I live my life far better, less complacently, and with more joy than I did before. I've learnt to overcome so many fears, and I am motivated by an absolute determination to be around for my boys, for my husband, for my family, as long as I possibly can. And to do that, I have to keep on learning, keep on taking risks, so that in the end, there can be no doubt that I did everything I possibly could. And I realise that's all a little familiar in that the first case study, Larkin's case study, was about me, so it was a bit resonant. But I get the